was introduced to cancer first time when I was 8 years old. I had an aunt, and when I saw her, I was terrified. She was skeleton, and I started to cry because I got scared of her. Money being invested in research, that means it's not a death sentence anymore. And this is where my passion is, because nobody deserves to die that way.
Watching any family member go through cancer and all the suffering that they're going through is very hard for the family members to watch.
What I really love about Sena Medical is the mission and the vision and the people. It's phenomenal. A woman-owned business, giving back to the community, giving back, for cancer research.
American Cancer Society has funded 49 men who went on and got a Nobel Prize. There is no woman yet.
Our goal at Sena Medical is to help fund that first female Nobel Prize winner from the Research Hers program for cancer research.
We believe in her breakthrough, we believe in her passion, we believe in her work, and we are going to do anything possible to fund her.
Sena and the American Cancer Society are honored to support women researchers.
We are absolutely confident, and we will not stop until that happens.
We want to reach every hospital in the United States of America and sell to every hospital. And that means it's millions of boxes, and that means millions of dollars for cancer research.
Because every box we sell, we give back to the American Cancer Society.
Whoever is buying our products and working with us is part of this magnificent project. It's part of this breakthrough. It's helping to make this difference together with us and the American Cancer Society.
If I would be able to go back to my grandfather today and tell him I'm doing everything to be able to find a cure for the cancer that you were suffering from, that would be my dream.
This is really in support of who we love.
We are very passionate to fund cancer research because we believe in breakthrough. We need to help. We need to give back. We need to make a difference together with the American Cancer Society.
Welcome, everyone. My name is Megan McNeely, and I'm a Senior Development Manager at the American Cancer Society, leading Research Hers in the greater Philadelphia area. Thank you for being with us for this special edition of Women in Leadership, a conversation in and at the lab. I'll be your moderator for our discussion this evening. You've just heard from our national corporate sponsor, Sena Medical. Research Hers Women Fighting Cancer is a movement of our community's most influential leaders and businesses who want to drive progress in cancer research and are passionate about gender equality. Throughout May, our researcher ambassadors across the country are joining together to reach our collective goal of raising $1.6 million to fund the mission of women-led cancer research at the American Cancer Society. I know we have a lot of people with us this evening, so please give us a thumbs up in the chat if you are one of our amazing ambassadors. And if you're not yet, we hope by the end of tonight's conversation, you'll be inspired to sign up. We'll have information throughout the night in the chat. Tonight, in honor of National Women's Health Week, our focus is on women in healthcare. When it comes to healthcare, women manage multiple roles: parent, spouse, caregiver, yet recognition of their significant impact on the health of entire families and communities is often overlooked. We're grateful to have two remarkable guests with us this evening to lead the important conversation. Joining us live are Dr. Pooja Rao and Dr. Lisa Schaffner. Thanks both for joining us.
Good evening. Pleasure to be here.
Happy to be here. Thanks for this opportunity.
So I've had the pleasure to get to know each of you, but I want to ask you each to share a little bit about your background, your current organization, and the role you play there. Pooja, will you start us off?
Yes, I'd be happy to. So my name is Pooja Rao. I am the director of the Penn State Adolescent and Young Adult Oncology program. In my professional world, I wear two hats. I'm a clinician, so I take care of children, adolescents, and young adults with cancer and other blood disorders. I'm also a clinical researcher, and my research focus centers on understanding better and improving the psychosocial care of adolescent and young adult cancer survivors across the cancer continuum. So psychosocial health really encompasses the mental, emotional, and social health of patients. And I certainly have a lot of thanks to the American Cancer Society, as they're currently funding one of my studies that's entitled Psychosocial Challenges and Professional Aspirations of Adolescent and Young Adult Cancer Survivors.
Perfect. It's always a joy to hear from our ACS-funded researchers, so I'm very happy to welcome you this evening. Lisa.
Thank you, Megan, and it's a pleasure to be here. I'm Dr. Lisa Schaffner. I am Vice President of Care Analytics at Highmark Health. Highmark Health is a national blended health organization, as we like to say. We are a combination of multiple payer organizations under the Blue Cross Blue Shield banner, including Highmark Inc., as well as a healthcare provider. One of our subsidiaries is Allegheny Health Network, based here in Western Pennsylvania, the Pittsburgh region, along with a numerous number of other companies that make up our organization. Within Highmark Health, I am part of our enterprise data and analytics team. And as I mentioned, my role as Care Analytics Vice President is to bring forward biopsychosocial insights into everything we do as we seek to transform healthcare through our living health strategy. By background, I am a doctorally trained health services and outcomes researcher, and I spent 15 years in academia before the last 10 working in industry. Glad to be here.
Fantastic. I'm sure our audience already knows why you were selected to join the conversation this evening. We do have a lot of ground to cover, so I'm just going to dive right in and get us started. My first question for you is, how have you seen gender shape health personally and professionally? Pooja, I'd love to hear your answer.
Thanks. I think this is such an important question and such a large question. I think from a personal and professional end, I think a lot of young women, myself included, often interface with the healthcare system at times where reproductive health is of importance. So for a lot of young women, contraceptive counseling is often their first foray independently to engage with the healthcare system. And the way that things stand currently, a lot of that responsibility in terms of reproductive health options sits with women, which is something that's not a bad thing at all. I really am passionate about women having that ability to make choices about their reproductive health in their bodies. So that's, I think, one way that women often engage with the healthcare system. I think from a personal end, another way that a lot of women engage with the healthcare system as well is when they're trying to start families and may need a little bit of help. And that was certainly a way that my husband and I engaged with the healthcare system when we were trying to start a family. And we were so thankful for all the safe and accessible options that we had. I think gender shapes health professionally for me in a lot of ways. I take care of adolescents and young adults with cancer. And a common piece of knowledge that not a lot of people know about is that breast cancer is actually the most common cancer type amongst adolescents and young adults, and it accounts for about a third of cancers amongst adolescent and young adult women. And that's something that I don't think a lot of people know about. We think about cancer, and specifically breast cancer, being in older women that are postmenopausal, but it's something that actually affects a lot of young women, and it's important for providers to be aware of. I think in my clinical research world, where I'm a clinical researcher, I certainly see how gender can shape interaction with clinical research. I personally have found that recruiting men into my studies is often more challenging than women. And some of that may have to do with the focus of where my research lies. But I think something that's really important for science and scientists is that we want to be as inclusive as we can of everyone and represent everyone in the research that we conduct. I think kind of along the lines of gender as well, another really important point to acknowledge is that we also capture research and information and data on people that may not identify with the gender that they were assigned at birth. So including people that are transgender and non-binary. It's really important that we capture the entire spectrum of gender to ultimately be able to provide equitable care for all people.
Fantastic observation, and I agree completely with that. Full spectrum of people needed to be included. Lisa, what are your thoughts?
I couldn't agree more, Pooja. I'll add to the numerous great points you made. Start by maybe talking about it from the data and analytics perspective. Certainly analyzing health by gender has been very revealing over the last 20 to 30 years of my career, where I have absolutely seen the differences in cases with respect to when certain diagnoses are made, when people access care. We see real differences in terms of men and women and in how they approach the healthcare system, but also if we go further upstream, how they approach health and maintaining health for themselves and others. Oftentimes in the research, we see that women are far more likely to delay care. And often the reason for that is that they're taking care of everyone else. And building a little bit on what you described in terms of how women generally enter the healthcare system, primarily at adolescence for contraceptive and reproductive care, I've really observed two main trends in terms of women's interactions with healthcare and how healthcare comes to women, as I like to say. One of those is certainly reproductive health. And what I've found over the life course is that much of healthcare for women is organized around reproduction. And you made the point about accessing healthcare for reproduction and having it to be safe and accessible. And what I found there is that if you are a woman who is interested in or has reproduced, that the system is very designed to focus on that group. But if you're someone who, like me, has chosen not to have children, or if you're not biologically able to have children but desire them, the continuum of care still is focused on reproductive health, which can be a real challenge if that's not the care you're seeking or need. And then relatedly, what I've also found is if it's not reproductive care that you're seeking, the default is weight management care. And even as we look at how primary care is transforming, and I think it's being transformed in this way because of perceptions or marketing to women, is largely on cosmetic care. There are often practices now that are introducing cosmetic procedures or having a dedicated set of cosmetic procedures available within basic primary care or even reproductive care. So it's an interesting, I think, dynamic if we think about care over time for women. And then, of course, women who are at the opposite end of the spectrum where they're perimenopausal, postmenopausal, getting them connected to the care that they need isn't always very smooth either. So I would say it feels to me like health care for women really is concentrated on a few areas, and any deviation out of that makes it really challenging to get to what you need.
I think those perspectives are just something that the common person might not think about, right? But when you say them, it's like, wow, that rings so true with me. That makes complete sense. And that's how my experience has been. So if you've joined any of my past conversations in the past, you know that I love reflecting on numbers. So I'm going to throw some data at you guys, but I think you both can handle it. Consider the following statistics that illustrate the significant role of women as healthcare decision makers and knowledge keepers. According to the U.S. Department of Labor, women make 80% of the healthcare decisions in the United States, and 77% of women who have seen a provider in the last 2 years have discussed preventative health topics such as nutrition, smoking cessation, and vaccines. Lisa, let's start with you this time. Surprised by that information?
Not at all. The only surprise I think I have is that it's only 80%, that I would expect it to be even higher, and even higher with respect to prevention. I think that knowing that women are very much accountable, whether it's for their primary families, for their parents, sometimes their in-laws, or the parents of their significant others. It's almost overwhelming if you are a woman in terms of who and how many people you eventually default to in terms of being accountable for their health and healthcare, or you choose to, I should say. So I think women are just very natural leaders and natural caretakers at the same time. Some of that, I think, is nature. Some of it's nurture. That's all debatable. But I'm not surprised to hear those numbers. In fact, I would expect them almost to be a little bit higher.
Pooja, same response or anything different?
I think, Lisa, you made great points, and I totally agree with you. I don't find that surprising at all. You know, I think about, as a clinician, the important discussions that I have with patients at important junctures of their care. So for example, you have a patient that's been diagnosed with cancer and you're sitting down with them and or their families to discuss the initiation of chemotherapy. I can not even remember, in all honesty, ever having a discussion like that without some female presence being there, whether that be a family member or a friend or the patient themselves. And I also think about other important junctures of care in the care of my patients is, for many of them, unfortunately, it's end of life discussions when you're discussing goals of care and plans moving forward. And I'd say even at those very difficult discussions, more often than not, there's some woman that's present in some capacity. So I totally agree with you, Lisa, about the role that women, both professionally and personally, that they play in being leaders and making healthcare decisions for all the reasons that you so wonderfully said. I do find the second statistic about preventive health measures and things like that really interesting as well. I find with a lot of discussions surrounding improvement of lifestyle decisions and behaviors, maybe it's a new trend that's coming, but I do find that actually both my patients that are women, men, they often initiate it on their own. And I haven't personally found as much of a difference by gender in that. So I find that really refreshing, and maybe that's also a sign of optimism and things to change in the future for our patients.
So as an ACS employee, I obviously am all for the preventative statistics being higher. We know that, like going to the dentist, cancer screenings should be a regular part of your life. And it's something that is done before the symptoms ever get there. So, I always say, make sure to talk to your doctor about the test that might be right for you and scheduling that's on your timeline. And that does bring me to the question of that relationship, that parent, practitioner and patient relationship. So one of the most important factors of women making good healthcare decisions is that strong relationship with a provider they trust. How is that trust built and maintained? Lisa?
Yeah, I think it can be very challenging to get to that level of trust, especially today where people, families, women move a lot more. I think about my own experience with establishing primary care here in Pittsburgh when I got here 3.5 years ago, after being in Cleveland for 3 years before that, being in Portland, Oregon before that. I've moved around the country a lot. And unfortunately, as healthcare is organized and delivered today, you can't take your provider with you. So when you find one and it's great, you really want to hold on to it, that relationship. I think what you can do in that situation, and also if we think about just how care is delivered generally now, many practices operate, for example, on multiple providers. Whoever's available sees the patient. They all coordinate behind the scenes. And that, I think, presents a unique challenge as well. So what do you do in those situations, whether it's moving around a lot, whether it's having different providers you see? I think it's a matter of finding what it is that you're looking for in terms of that communication style, in terms of the provider being able to relate to you and your concerns. Often it really comes down to relationship building. And really seizing that. In my own personal experience, I was very fortunate I think I'm very privileged to work in healthcare. And I was able to tap into resources, people who knew our system here, our Allegheny Health Network, when I got to town, who not everybody has that privilege or that access, and to ask them who I should see. Now, what's interesting to me about that in terms of data and analytics is that I hear my colleagues often say, well, how do we optimize the matching patients and providers, and trying to do that in some sort of quantitative way, or do we look at quality rankings? And I used to get really excited about that information, but what I've really come to appreciate in my own life is it's often just figuring out who knows somebody good. And by good, it's a lot of testing and learning. But I was very fortunate in order to find the provider I have now, who I absolutely adore, through talking to now, how do we make that scalable in order to build the kinds of relationships I think we're talking about here? I think that's the next big challenge. I think data and analytics may be able to help with that, but I think it's also going to be a matter of blending that quantitative information with really the qualitative experience. And unfortunately, I think a lot of it is just trial and error.
And Pooja, I know you're a mom as well as a clinician. So what is that kind of dual perspective from your end?
Wow. Yeah. I mean, I think I think Lisa said, her response so beautifully. I think a lot of it is finding the right fit. And I'm also very fortunate and privileged to love all the providers that take care of my children. And I think you learn a lot from that clinical care and how that can even help model your own clinical care. I think as a physician, you have an enormous responsibility to patients. And I'd say medicine is really one of the only fields out there where we're allowed to physically touch the people that we interact with. It's kind of a given part of the exam. Patients expect an exam, and you have to touch patients to do a physical exam. And that's really something so unique to medicine. There's really no other field, or very few fields out there where that's allowed and accepted and expected. So I think that knowing that, I think to me really impresses on me the importance of trust, to have someone to be able to trust to be able to do that exam. And I think as a clinician too, you end up finding out a lot of really personal and intimate information about your patients, things that they wouldn't even disclose to people that they love most in the world. And when you take a step back and think about that, that's an enormous responsibility. And how lucky are we in our field to be able to help people in that way? I think as a clinician, something that I try to practice and that I admire in other clinicians that I also have encountered through my training is that it's really important also not to have preconceived notions about the person sitting in front of you. I think it's very easy sometimes to make a snap judgment about anyone, not even in a clinical field, based on how they look or their background or what you know about them from a chart. But I think when you have a living person in front of you, I think it's really important to set any biases that you have to the side and really understand the journey that person has taken to get to see you.
You both are giving such relatable answers. I kind of feel like you might have been sneaking at my diary or, kind of taking peeks of some of my notes. But another topic. So studies show that when it comes to their care, women are more willing to step outside of that traditional box, right, of what healthcare information and wellness looks like. So what are some new non-traditional tools that are being used successfully to help women navigate what can be a complex and sometimes frustrating healthcare industry? Pooja?
Yeah, that's a really wonderful question. So I have the fortune to take care of a lot of young people who are much more technologically savvy than I am. Technology is not my jam. Let's just say that. So a lot of my patients often get information, medical and non-medical, through social media or through the internet. And as much as I have to kind of put my personal biases about social media a little bit to the wayside and realize that this is a way that a lot of my young patients interact with each other and communicate with each other and get their knowledge. So I think one thing that I've really had to change in the way I approach clinical medicine is acknowledging that fact and really being open with my patients to say, if you hear things from chat groups that you're part of or other support groups that you're part of through social media or through the internet, please share what you learned with me so we can talk together about what may be correct and what maybe may not be or may not be pertinent to your situation. Because I think while there's a lot of wonderful things that can be gained from social media and the internet, there's certainly a lot of incorrect information out there. And it's important for young people to have someone that they can talk to know what is reputable and what's not. I think another aspect of care that I think has really changed during my training to where I am now as an attending has been the importance that complementary and alternative medicine practices also plays with oncologic care. I think, not too long ago, I think a lot of oncologists would kind of just put that whole field really to the side and say, we don't really know what the role of certain practices or medicines or supportive care regimens may be. But I think we've realized now over time that that's something that's really important to patients. And not only is it really important to patients, it can really benefit them. And it's some way that patients can have some sense of control over their healthcare when in oncology care and in cancer treatment, we really take that control away from patients. So it really behooves us as a field to search for good sources of complementary and alternative medicine that are of interest to our patients. And I'll say at Penn State, we're really fortunate to have wonderful resources in that realm to offer our patients. So I'm really thankful to be at an institution that can give that to my patients because I know how much they benefit from it in a myriad of ways.
Lisa, what's in our toolkit, or what should be in our toolkit?
Or I will say, Pooja, starting on the note that you ended on, Penn State certainly has a wonderful array of complementary and alternative medicine options, and I think those are certainly options that people, and women in particular, are seeking more and more to bring together more of a holistic picture of health and wellness and care needs. And when I say that, I couldn't agree more. I think that, and I see more and more people using social media as a resource. And I have to also put my biases to the side, if you will, about that. I think it's really a mixed bag, if you will, out there in terms of what's available and who's providing it, and what are the primary sources people are getting their information from when they produce it and curate it into social media. But there is certainly a lot out there, and people are using it. And I think the question is figuring out how to navigate, right? I think also, though, there's a great proliferation. You mentioned technology not being your jam, which I kind of had to chuckle at because there is definitely a proliferation of digital options that people are using, whether it's using your Apple iPhone to track certain metrics, even if it's using an Apple Watch to track your steps every day, or a Fitbit. There are lots of ways people are using technology to deal with health and healthcare, to navigate. I know Allegheny Health Network, like many healthcare delivery systems, we leverage MyChart via Epic to maintain all of our personal data and our appointment data. And it's a great it's a blessing and a curse, I think, in that digital solutions can save a great deal of time, but anytime, this is coming from being in data and analytics for a number of years, anytime you compress information into smaller bites or chunks, you lose context. And so oftentimes, metrics, I know I had a friend recently ask me, what about your total daily energy expenditure? And if I use that and I calculate this, I can find out exactly how many calories I have to eat a day. It actually doesn't. It's great. It's good digital information, and maybe you can calculate all of that or use an app to figure it out, or to track your food or whatever. But the body and the mind are much more complex than that. And so what I always like to tell friends and family who are using digital solutions or social media is it has a place to serve as almost a marker or to give you some insight, but it can't take the place of good, solid, clinical information from trained professionals, and that they are really the right people we should be going to with a number of our questions. Now, if we're thinking about health and wellness more broadly, things like just taking good care of yourself, your mind, your body, and spirit, that's not necessarily where healthcare professionals always have the answers for us, nor should they. And we have to think about what is it that they need to be doing to practice at the tops of their licenses, as it's said. There are, I think oftentimes we've become as a society very directed in terms of our health to the health care delivery system, when in fact going further upstream, and I come from a public health background, going further upstream and really thinking about what are the day-to-day things that you can be doing for yourself and for others to make yourself feel good, again, mind, body, and spirit, and doing those, just taking care of yourself.
So we can't really talk about that topic without talking about the next one, right? Not everyone has that equal access. There's staggering disparities across all different socioeconomic, racial, education backgrounds. So what are some of those suggestions for closing that gap and improving gender equality in health? Pooja, let's start with you.
This is a really wonderful question. And I have a lot of thoughts on it. I think a big way to close that gap is through research. Through research, we can ask provocative questions that we don't know the answer to. We can scientifically learn how treatments differ, how interventions that we develop to make people's lives better work. So I really do think research, and clinical research in particular, is really important, especially for improving the lifestyles of patients and people as a whole. I think, on a more personal level, what can I do as a clinician scientist to help close that gap is something that I have thought about a lot. And I think one thing that really comes to mind is, situations where, for example, I may be recommending what I think would be in the best interest of the patient sitting in front of me. And despite my recommendations and citing evidence and, telling them why this may be good for them, that behavior doesn't change. And I think, smoking cessation is a great topic. This certainly came up a lot in my training. And I think for a lot of physicians, whether it be smoking cessation or maintaining a healthy weight or making healthy diet choices, sometimes it can feel like, why are things not changing when I feel like I'm passionate about implementing these positive changes in my patients? And I think one thing that I found helpful that one of my mentors very early in my training had said was, well, why don't you take a step back and see why they're making the choices that you feel aren't in the best interest of their health? Like, try to put your literature and your studies for a second to the side and see, for that particular patient, why are they making those choices? And I think in a lot of situations that really shed a lot of light for me as to why people make the choices that they do. And a lot of times people make choices about the lifestyle they live through for reasons that really aren't even under their control. And especially with children, I think I see that a lot too. So I think sometimes taking a step back and trying to align with your patient to try to promote healthy behaviors has been a helpful tool for me in forging that trust, like we talked about, with patients. And ultimately, it's something that helps everyone, right? It only strengthens that bond. And I think that importance of taking a step back and understanding decisions made is even that much more crucial for women and for families that come from marginalized and minoritized groups. We really have to take that extra step to understand why those decisions are being made.
Lisa, I know this could be a topic all of its own, but give us your thoughts on how to close that gap.
For sure, Pooja. You touched on something I think that's really important when it comes to social determinants of health that has to be remembered. I think it's been great as somebody whose training is in public and population health, and we've known about SDOH, as they're now called, for at least 40 years, and to see that the world, and especially the healthcare industry, is getting engaged with social determinants, recognizing that the delivery of care, as an example, or receipt of medical care, while very important, represents about 25% of an individual's health. And that disparities do persist in terms of health and healthcare, in terms of access, as we've talked about. And speaking from the perspective of data and analytics, we have an increasing proliferation of data about social determinants that we can do all kinds of wonderful analyses of, and we can understand cohorts and subcohorts of populations and what is impacting them. And how those different social determinants are showing up and how they're impacting, again, both health and health care. And at the same time, to your really good point, Pooja, until we know that individual patient or individual member, sometimes within a health plan as we refer to them, we don't know their personal circumstances. We can say, oh, we've recognized, say, a social determinant or a determinant that's impeding their ability to access care as their transportation because they're not getting to it. It's because they live too far away, or maybe it's geography. But until we talk to them to understand, is that really the case? We have to validate that. We have to use that information. We find it. We have to go back to the person and say, what is it that we can do to help you? And that becomes really challenging because I think what we're trying to do as a society and within the healthcare system is scale solutions to populations to make care much more accessible and to address the disparities that Megan, you described very well. And at the same time, where we're really challenged is that healthcare is very personal. And so how do we tap into as much as possible what that person individually needs in order to resolve those challenges that disparities and social determinants present? And something, I'll finish by saying something I remind people of is that social determinants of health can be both positive and negative. One could have great social support, which is a social determinant of health, and have a very connected network of people who can help them, versus the opposite, which is a negative determinant of health. And we have to remember that social determinants aren't what happen to people that are always the negative. Rather, there are positives that we can build upon to perhaps change some of those negatives into positive determinants of health.
Both of you are just spot on, right? That personal connection. So I know we've talked about women being that chief health officer of their families and primary healthcare consumers. They're the leaders in their community's health conversations. However, we're not really good at taking our own advice. So what is self-care and why is it so important for our health? Lisa, your thoughts?
Yeah, self-care, to some of my earlier points, I think is absolutely critical. When we need health care formally for our health, there needs to be better access to it. We have to address the disparities that were described. But self-care, I think, is a matter of that primary prevention that we have to practice in order to keep ourselves not only physically well, but mentally and spiritually well. And self-care can be as simple as making sure you take a break during the workday, where a lot of us are now living via Zoom and other tools and going from meeting to meeting and task to task, taking that step away and going and having lunch in a different location. I think to me, that's been one of the great benefits of working much more frequently remotely. Recognizing what you need and not feeling ashamed for it. I think we often as a society, get caught up in what the expectations are, especially the work ethic, that we have to be constantly working. And if we're not constantly working, what are we doing? How are we living our purpose? In order to really do our best work, and by work, I mean living, breathing, sleeping, whatever that work is, right? In order to be able to do that, we've got to replenish ourselves. We have to make sure that we are taking care of ourselves, and especially as women, where, as I said earlier, and Pooja, I think you touched on this too, we are naturally leaders. We are naturally caretakers and caregivers. And if we don't take care of ourselves, our cups will not be full to be able to serve everybody else that we want to serve and maybe even need to serve in our lives. So thinking even just about the small things we can do day to day, whether it's having a ritual, whether it's just connecting with somebody on something completely outside of say what you're supposed to be doing at a given point or what you feel like you're supposed to be doing, that can make all of the difference in the world and help us continue to keep our eyes on what it means to be truly, fully healthy. It's not just the absence of disease, it's mind, body, and spirit feeling well and wanting others to feel the same.
Pooja, I know you have some thoughts as well.
I mean, you said that so beautifully, Lisa. I totally agree with everything you said. I think self-care sounds really indulgent, like we shouldn't be taking care of ourselves when there's so many others around us that are needing us, in a variety of aspects. But I totally agree with you. I think you can't pour from an empty cup, just like you said, so to be the best version of ourselves, we have to take care of ourselves to give all that we want to give to those that deserve our time and effort, whether that be our families, our friends, our coworkers, our patients, our colleagues. So I think you said it, we can only be the best version of ourselves if we take care of ourselves.
I think it's fascinating that you both talked about self-care being the ability to help pour into others. Once again, showing that women, no matter what, even when we're saying, what's the advice to take care of yourself? Part of the advice is because we want to take care of others as well once our cup is full. So I just wanted to point that out because I thought it was very interesting. It also is interesting in that, that is kind of how we're here today. Research Hers is about women supporting other women. And we've come today as advocates in support of those women. So thank you for joining us and standing with us. And we know that since the beginning, women have led the way at the American Cancer Society, and Research Hers is ensuring that we continue to do so. The funds that fuel women-led cancer research, to do that, we look for influential women across the country who are community business leaders who are ready to fight for a world without cancer. And we call these leaders our ambassadors. We can never have too many. So if you've become passionate through tonight's conversation or came passionate and want to continue and help elevate women in the field of cancer research, there's still time to join the Research Hers campaign this month in May. You can visit www.acsresearchers.org to learn more. I want to thank you all for joining us. And the conversation always goes so quickly, but I hope you have a lovely evening and we look forward to chatting again soon.